We are going to be talking about why the expansion and funding and availability of the pre-exposure prophylaxis, also known as PrEP, should be implemented. To begin, for the introduction, the topic at hand is whether or not the expansion of PrEP should be expanded, funded for more accessibility. The controversial conversation at hand has to deal with the allocation of money, having to determine who is responsible for this, whether it's the people or the government for the money. This also has to deal with the expansion with widespread provider teaching, the willingness to provide, such as nurse practitioners and doctors themselves, and the removal and destruction of negative stigma. Unfortunately, it's hard to determine who is on which side since the topic of HIV is known to be a big LGBT problem with the emphasis on gays and transgendered women. But even they have their skeptics and antagonists. However, we also have doctors on board, and it seems that the more likely the education of this particular drug, the more willingness and understanding they are to contribute the drug and prescribe it, and also cover it through insurances. Those who support would want PrEP to be implemented more frequently and wided since it shows and believed to be the fighting source for eradicating HIV, not just preventing it, not just getting rid of it, but actually getting rid of the disease itself in the United States. Those who are opposed are more focused on money being allocated for other uses and believe this medication can contribute to other other unsafe practices, I'm sorry. As for the roadmap, what we're going to be discussing here today are the definitions, historical context, detailed argumentation, supporting evidence, and the evaluation and critique. To begin with definitions, we have the standard LGBT definition, which has been wide known forever. It would be hard to find a pinpoint source for that one. It stands for lesbian, gay, bisexual, and transgender. Next, we have PWID, which stands for people who inject drugs. Now, this is a big part of the HIV epidemic that's going on and one of the part of the disparities. So that's why it was important to include. We have reverse transcriptase, which is an enzyme that viruses such as HIV uses to copy its genetic material and reproduce within cells of the body as its own DNA along with the regular body's DNA. What makes this virus, such as HIV, so different from regular viruses is that the virus actually incorporates a DNA sequence in the regular DNA of the human body rather than just its RNA. And so therefore it uses the body itself to reproduce rather than replicating on its own and its own energy. That's why it becomes such a difficult disease to fight. And also it mutates on its own in regards to treatments and certain medications. Next, we have HIV, which is a human immunodeficiency virus. It's a virus which utilizes the characteristic called reverse transcriptase, which weakens the body immune system to fight infections. The specific body immune system that used to fight infections are called CD4s. Now, there's AIDS, which is acquired immunodeficiency syndrome. This is caused by the virus HIV and it damages the body's immune system to the point where it can't adequately fight infections or diseases. So any little type of infection can be detrimental to someone with AIDS. Now, this is important because that means that the CD4 cell count is below 200 cells per cubic millimeter. And then we have PrEP, which is a pre-exposure prophylaxis. That's an antiretroviral known as Truvada that prevents HIV transmission along HIV negative people at risk for HIV prevention. Now, this is beneficial and works against HIV by blocking reverse transcriptase. Now, once reverse transcriptase is blocked, then HIV itself has no potential to replicate or cause harm to the body because you cut it right at the base, so it has no opportunity to advance. We begin with the history. Now, the HIV epidemic is a huge, long history, and I try to sort it and I try to shorten as much as I possibly could. So I start off with the 5 previously healthy white gay men in Los Angeles who experienced a rare lung infection known as pneumocystis carinii pneumonia and noticed their immune systems were not working, alongside a New York dermatologist who calls the CDC about Kaposi sarcoma, a rare skin cancer among gay men with weakened immune systems as well. This is how we begin to see the common signs and symptoms of AIDS. Now, on March 4th, the CDC comes up with the idea that this infectious agent is most likely transmitted sexually or through the exposure of blood or blood products. By 1984, the discovery of the retrovirus HTLV type 3, which causes AIDS, is identified, thus getting HIV. By 1985, you come up with a system and it detects antibodies and antigens, which allows you to detect HIV through a blood test. So it makes it easier to determine who's infected and who's not. By 1987, the FDA approves the first medication for AIDS known as AZT, which is a previous cancer medication. April 7th, 1987, the FDA declares HIV prevention as new indication for male condoms. Now, this prevents our first line of prevention methods. By 1992, the AIDS becomes the #1 cause of death in the US from men ages 25 to 44 in 1994. Now, this is just tackling men, but by 1995, all Americans ages 25 to 44 are affected. And then HAART is approved, which is a highly active antiretroviral therapy for HIV to help release some of the symptoms and to help decrease the risk of the CD4 cell count to reduce. Now, in 1998 is important because Donna Shalala determines that the needle exchange programs are effective and do not encourage the use of illegal drugs. This is important for something that comes up later on. By 2010, studies have shown that a daily dose of HIV drugs reduced the risk of HIV infections among HIV negative men by 44%. This creates the concept of PrEP. By July 13, 2011, studies are confirmed by 2 different trials. By 2012, the FDA approves Truvada as PrEP. In 2011-2012, the United States Centers for Disease Control, which is the CDC, launches the High Impact HIV Prevention, which is known as HIP. And that responds to research showing that antiretroviral therapy reduces HIV transmission, which kind of gives it the little boost that it needs to promote PrEP. In our detailed argumentation, we have why hasn't PrEP been expanded in funding or availability, and we also have why PrEP should be expanded and funded. To begin on the opposition, it has believed that it can worsen existing disparities. So for example, if you have existing HIV, people are wondering that if you spend more of your time and money on allocating for PrEP, then why are we not allocating for actually curing HIV? Now, viruses are much more difficult, and this is a different topic to get into, but this is some of people's main concern. And then we have people who inject drugs. Those people are worried that if you implement HIV in these groups, then they're going to continue using drugs and continue to create or allocate more for the opiate crisis. And then there's more sexually transmitted diseases. So and there's studies showing, unfortunately, that the use of PrEP, people tend to think that they can do whatever they want. And so they forget that there's still other sexually transmitted diseases available. Now, another thing is that it promotes, there's negative stigma to it. So people are assuming that if you take Truvada or you take PrEP, that you are promiscuous, you're considered a Truvada whore, and you're trusting that it works, indicating that there's a possibility that you still can get HIV while taking PrEP. So there's fear that it actually doesn't work and it's just gonna create more harm than good. Then there's the cost, which is about $22,000 a year or $2,000 a month, but it's still pretty expensive. And there's constant funding to family planning clinics, and those are the main sources of prescription for Truvada, since it starts at the family practice or infectious disease, but mainly the family practice. So there's constant funding to it, then there's less chance and opportunity to prescribe Truvada. And also white males are more likely to be covered compared to this Latino Black counterpart. So people are assuming these disparities, and also it's kind of hard to be able to implement PrEP, but knowing that your white counterpart is still going to get benefited more rather than your Latino and Black counterpart. So there's still the problem there. Now, it should be expanded because the #1 reason is that it eradicates HIV. It is the main goal. It is one of the 3 steps in order to end HIV. And then also, when educated about PrEP, there's better safe practices. However, this is kind of opposite because once it's implemented, those safe practices go down, which is an interesting statistic. And allows for more innovative ways to expand healthcare in general. Once PrEP began to be expanded and prescribed more frequently, people started including things like telehealth. And I know we've seen a lot of telehealth lately because of coronavirus, but PrEP was one of the main starters for this type of doctor's visit. It can create more availability for insurance and funding and for other medicinal needs. So basically, if PrEP begins to be expanded and funded more frequently, it kind of sets precedent for other medications of prevention as well. It is not just affecting one demographic. As we've seen, it affects ages 25 to 44 for the longest time, was the #1 cause of death. And it doesn't affect one sex because it affected all Americans, men, female. transgender, and also not one age. At one point, it wasn't included, but at one point, it was the #1 cause of death for infants. Now, here we have supporting evidence. I'll read off a few. That people in rural communities in Iowa who are at high risk of HIV now have access to PrEP through the state's innovative telehealth program. So we can see some expansion. And also, we show here that prior studies have shown that those who are unaware of PrEP report greater sexual risk taking. So even educating people about PrEP allows people to become more educated about safer sex practices, which can reduce HIV, but also other sexual transmitted diseases. And an increase in PrEP utilization is considered vital to combat the HIV epidemic in the US. From some reporting evidence for the opposition is some claim it's unfair to cause more issues with those suffering with HIV if we begin to support and expand PrEP, but not do the same with the antiretrovirals for HIV. Also, the 30-day supply can cost as much as $2,000 without insurance. Once again, the quote for True Auto Horrors. And also right here, it states that Black male transgender women currently using PrEP were more likely to report giving and receiving goods for sex, female sex partners, and lower occurrence of condom use during receptive and anal sex, which can contribute to the higher sexual transmitted diseases and just can contribute to the fact that there are more unsafe practices when using PrEP, unfortunately. Now, the evaluation, here are some of the inconsistencies that I found is that PrEP can worsen existing disparities, but as we stated by Donna, the previous Secretary of the State of the Health Department, she even stated that needle exchange programs do not contribute to increase drug use. So I wouldn't see how HIV could contribute to that. If giving people clean needles for the opportunity to do drugs is not causing it, then how can a prevention of HIV drug do that as well? Another inconsistency is that PrEP education increases with condom use, safer safe practices, and exchanging sex for goods. But once it's implemented, it actually decreases all of these. So that's another inconsistency, which seems a bit odd. And PrEP is understood nationwide to prevent and eradicate HIV. However, providers are not taking it upon themselves to prescribe it or educate others on it. Finally, is my critique. If PrEP is not funded or expanded, a majority of these things will happen. There'll be increased difficulty with the HIV epidemic since it continues to mutate, especially against medications and the body's natural defenses. There'll be an increased amount of deaths in regards to HIV, AIDS, and HIV-related complications such as pneumonia. Less education about PrEP has negative correlation with less education on safe sex practice. Thus, higher sex risk-taking behaviors take place because we've seen through the studies that less education is opposite and increases higher sex risk-taking behaviors. And then people in rural areas, lower incomes, Hispanics, Latinos, Black, and minorities in general will suffer at a disproportionate rate compared to the white counterpart due to the lack of funding, lack of insurance, lack of opportunity, and lack of offices.